Hello, pearls of the internet. Here I am again on the channel with another fabulous guest. Let's go straight over.
Hello, my name's Josh. I'm 26, I live in London and I work for Christian Dior.
So Josh, why don't you tell us a bit about what brings you here?
So I was watching your videos online and I wanted to try and get a more enhanced but natural result on my face.
Okay, and which bits of the face are we treating?
So I'm more, well, not like worried, but about I would like a stronger jaw. And maybe some of like, I'm now 26, so aging is starting a little bit, so just like rejuvenation kind of thing.
Okay.
Yeah.
And was there anything in particular that you were thinking, like, that you'd like to try? I know that we spoke a bit about doing jawline fillers, but talk me through.
Just maybe like increase like maybe like a higher cheekbone would be interesting, and just like the overall shape, like just kind of finessing it. Yeah, giving like more structure to the face.
And have you done any kind of cosmetic treatment before?
I did Botox with a friend, but it wasn't very effective.
Why?
It lasted like not even a week. Like, it didn't even last a week. I did it twice. Once it lasted longer, and the other time it was just a waste of time.
Oh, that's interesting, actually.
Yeah.
I wonder why.
I don't know. I don't think I reacted to it very well. I'm not sure, or it just wasn't done correctly. I'm not sure. It just wasn't very.
I don't know, because sometimes it depends on the dose as well. So if it's a really, really low baby dose, it doesn't tend to last for that long. But okay, so is there anything at all that you're particularly concerned about with regards to the treatment?
So I kind of like scared myself by reading a lot of the side effects.
Yeah.
So obviously there are some things that can go wrong with it, and it does scare me a little bit. So it's made me nervous. But.
So we spoke earlier today about particular concerns around blindness.
Yeah.
And we discussed that there are certain things that we try and do to mitigate that, and I'm just really speaking actually to you guys at home about this because we already had this conversation. So it's possible to go blind when you have dermal fillers done, and the reason for that, people always ask me, is because it's particulate, so it's a gel. So if you imagine your blood vessel, as it gets further and further away from your heart, it gets narrower and narrower and narrower, and it spreads off into more and more branches and becomes finer into little capillaries. Well, if you inject something particulate into it, then it can block the flow of blood, because it's a gel, so then the blood can't get past that, and that's a vessel occlusion. Now you can have that kind of vessel occlusion also occur in the back of the eye, in the retina, and you can have that from any kind of dermal filler or fat or whatever you want to inject into your face that's particulate, not Botox, from anywhere that you've injected on the face. But there are certain areas which are a bit more high risk, like the nose and the forehead. And there was a study done not too long ago which showed that about 45% of all cases of blindness have occurred in South Korea. And it's not because the Koreans are bad injectors, it's just because their idea of beauty is a bit different to ours, and they inject an awful lot into the forehead and also into the nose. So we're talking, sometimes 10 mils just put into those two areas, which we tend not really to do over here. So over here in the West, it's more about the cheekbone and the jawline and sometimes the chin as well. So nevertheless, it has been documented to occur anywhere on the face, but it's just not very likely. And there are certain things that we try and do to mitigate that risk. So, for example, you'll have an idea of maybe where a blood vessel is kind of heading, or what depth it's going to be in as well. So you just avoid that area. In certain areas, we'll use a cannula rather than using a needle because it's harder, no, not impossible, for a cannula to enter and pierce the blood vessel. So it's all these little things which together mean that the treatment is a lot safer. But in terms of absolute numbers, it's really quite a low number. End of monologue. Okay, so I'm going to hand you the iPad and get you to make some marks.
Right.
Go for it.
Okay.
Be brutal.
Be brutal. So my biggest thing would be my jaw. I would like it sharper, just a little bit more pronounced.
At the angle.
Yeah, I just think it kind of gets. You know, it's more. It's all right when I keep my head up and everything, but when I like move around, it kind of all weakens. So anything that would make that more defined, I always thought I'd really like. And I think that my eyes are kind of like down a little bit. Like,
which bit?
I would say like, I don't know. Just I think it's maybe the eyebrow. Like I feel like it kind of all starts to kind of go down. It all looks very like it's like I've got like sunken eyes anyway, and it's like I think it could be like a little bit more like lifted.
Horizontal.
Horizontal, yeah.
Yeah, because the tail of the brow is like lower than the head of the brow there.
Yeah.
So yeah.
And then so I've always been unsure about my nose because I know I've got a bump in. Like this is something that I've always just like gone back and forth whether I would ever do it or not. Like whether or not like sometimes I like it, sometimes I don't, and it's like it has a bump here. But I kind of think if I removed it, it could make my face. So the other thing that I don't like is the length of my face. I would like it more squarer. It's like the general like anything like so. And I think part of that's why the nose comes into it. Because I always like kind of like push it in the mirror, and I'm like, if I was to do it, it could make my face even longer because it wouldn't have that. So I'm not sure. So I don't know if that would be like beneficial or not. So those are like my main concerns, and then there's like other tweaks, but like that's my like.
No, let's go with the tweaks. Tell us.
And then I think I like could have a more pronounced cheekbone, and ever since now that like I've got 26, I feel like this isn't as voluminous as it was. But that could be my paranoia. But it's probably a thing. So yeah. And in terms of, lips in pictures looks always fine, and I've always had like kind of big lips, and I wouldn't do it. But again, if there was a way of making them wider, it's all about like less length and more wider, and that's what I always think about. Well, because I've got a narrow smile as well.
You do.
But you can't really like. I've always kind of just like accepted that is just my face.
It's kind of tricky because the distance in between your eyes is not huge.
Yeah.
So ideally,
it would disproportionate.
Yeah.
If you messed around with it.
Yeah, it would look weird, I think, if you went wider.
Yeah.
I mean, you might get away with it when this is all widened here. Yeah. Perhaps. I don't know. We'll have to see what it looks like tomorrow.
Yeah.
We'll decide.
Okay.
So let's go and do it.
Let's do it.
So using some Radiesse first, we're going to do 1.5 mils to the angle of the jaw each side. And then we're going to repeat that again so that we've got a total of 3 mils of Radiesse at each angle of the jaw. Changing now to some Juvederm Ultra 4. We're going to do 0.5 mils per temple. And now using Vollift, we're going to do 1 mil per side, just near the base of the nose of Vollift. Slightly changing our angle now, we're going to use some Radiesse from the angle of the jaw now up to the ear to really just strengthen the jawline. And that's a total of 0.75 mils per side. Juvederm Ultra 3 on the cheekbone, 0.5 mils per side. And then Ultra 3 to the front part of the cheek, 0.5 mils per side. So now we've used a total of 12.5 mils. And we're just going to finish up by doing the lips with Ultra 3 using a cannula. There's a little bit of pre-existing asymmetry here, so I'm going to add more on the left side than on the right. So from your perspective, how did it go?
I think it went really well. I was really happy with the results in general. Yeah.
Any like bruising, swelling?
So there was like 2 tiny bruises on my cheeks, which like went in a couple of days, but super like not noticeable. And then I had some soreness in my lips. That was like a big one.
Yeah.
For like that was the only one that was like actually like kind of painful, but again that kind of like reside, and like the jaw was a little like sore, like tender for like a little bit.
So were they really swollen?
Yeah, I wasn't expecting the amount of swelling just straight initially after, but like the next day, like it was like, for me, it was such, because I'm very really anxious anyway, but it was such like a shock, and I was like, oh my god, I couldn't imagine it to reside as much as it did, but everything like went right down.
Yeah. How long do you think that took?
To really settle, I'd probably say 48 hours.
Okay.
But like it was like a dramatic difference by the next morning.
Yeah.
Like from when I left you.
You mean it was bigger?
Like no, everything kind of
I see.
settled.
Okay.
Yeah.
Okay. Yeah.
No, it was, the biggest part was literally immediately after the chair.
Okay. So were you really scared when
Yeah.
you looked in the mirror?
Yeah, because I know you said you're like, it's going to be a bit action man-y for a while.
Yeah.
But I was like, okay, but like, because you've never done it before, you don't know how much it's going to reside by. So you're like, is it going to stay like this? And it kind of like scares you, but then it doesn't, so it's fine.
Yeah.
But,
Everybody says that.
Yeah, that's the only thing like I like wasn't expecting it to be like that.
Yeah.
But it was fine.
Okay.
Yeah.
You made it through.
I made it through.
Okay. Did you get any compliments?
So it was like a mixed bag of like people noticing or not noticing. I kind of like disguised it with a haircut.
Smart.
And one of the people, I came into work the next day and they were like, you look like you've had a really good night's sleep. They were like, what have you done? They were like, something's not right. You look like you've slept for like a year.
That's a result.
And I was like, maybe.
When we were talking before as
Yeah.
well, you said that somebody at a party came up to you as well.
Yeah, I was at a party and the girl was like, have you had your lips done? But then I kind of had that before anyway, because I already had kind of big lips, but there was like, because she had hers done and she was like looking out for it. She's like, I can see you. She's like, tell your sister what you've done it.
I think there's like a group, we're a group of people who have had stuff done, so you kind of know what to look for on other people.
Yeah, you know like the telltale sign. But even before people asked if I had my lips done.
Yeah.
I didn't. I was like trying to work out if I was like, oh my god, are they like really noticeable now, or is it just from before? Because then you just automatically, you're like, it just makes you think. But like, my mum was the most disappointing. She was like, you look the same. And like I thought of all the people, she would like, everyone else would like at least see what's like, when I've explained it to them, they'd be like, oh my god, okay, yeah, I can see, da da da. And my mum was just like, she just blind.
I think that's often mums though, because when I had my nose job, my mum didn't pick up on the fact that I'd like literally had surgery on my nose.
Really?
Yeah, she didn't see it at all.
I don't think they see you. They're just like,
no.
They like that.
I think they just, in their head,
They've got an image of you.
Yeah.
And it just never changes.
It just doesn't change.
Even if you like, yeah.
So I think actually weirdly I read an article about that and about like husband and wives, and apparently you always think about your spouse as they were like maybe when you met them.
Really?
Yeah, apparently so. Yeah. So
a little bit of that's going on, I think.
I think it must be. Yeah. Well, that's great. Sounds like everything was great. What was the best bit for you? Like the most impactful result, the bit that you liked the most.
I guess the jaw still I liked. Like I thought that was quite a like big difference. And it's funny like when you're like taking pictures like different angles and things, like you have to kind of like change it all up. And then immediately after, like I really liked the cheeks because they were like really like. Whoosh.
Would you go more?
I would maintain.
You'd maintain, okay.
Yeah. I don't know about more.
Yet.
Yeah. But I would want to maintain everything. The only thing I wouldn't do again would be the lips.
Yeah.
But everything else I would do again.
Well, I guess yours were full anyway.
Yeah.
So.
But it's like nice to have like a summer of like big lips, but like it's gonna be fun. But I wouldn't do it again because I didn't think it was like. Yeah. That's the only thing I wouldn't like redo, but everything else I would do again.
Yeah, I agree with you. I don't think you need to do them.
Yeah.
But you know.
But it's fun. I was like, we were like at that point.
Yeah, I think it's interesting to see.
Yeah.
What it would look like. But yeah.
And you never know. That's the whole thing about doing all of it, because then you never know, and then you can like refine.
Yeah, exactly.
So.
And if you don't like it, you can always take it out. So you know.
And it wasn't even I didn't like it. It was just like, would it be like I didn't think it was like needed compared to the rest. So like, that's the only thing. Like.
I get it.
Yeah.
Okay. Well, that's cool. So maybe I'll see you again. at
Yeah.
some point. Great, cool.
Definitely.
Okay, guys, so that's it for this week. I hope you enjoyed the videos. These videos are coming out now every 2 weeks, so I will see you guys again in a fortnight. Bye again.